Hello everyone, thank you for joining us today for our Facebook live event on joint pain. I'm glad you could join us, and today we're going to be talking about what causes joint pain, what we do in the clinic to help people with it, and what you can do to help yourself. So my name is Dr. Kerry Yerkew. I'm a chiropractor here in Kelowna, and I've been practicing for over 25 years. And I've helped a lot of people with joint pain, people with spinal pain, people with knee and shoulder pain, TMJ. So we're going to talk about a number of different joint pain today and what causes it, and then what you can do to help yourself with the pain. How does joint pain start? Well, joint pain starts with either an injury to the joint, maybe you have poor balance or poor posture, and that can cause pain and discomfort in the joint. So you're overusing one side compared to the other, and the joint can start to get damaged from being overused. This can cause inflammation in the joints, and with the inflammation, there's nerve receptors in the joints, and they can start to give you a sense of pain or discomfort. It's basically your body letting you know that there's a problem in that area. Also, a lack of movement. So sometimes people have injuries or poor posture, and they get really stiff, and it's very hard for them to move, bend, twist, and those joints can start to not get enough nutrition, not get enough synovial fluid circulation in the joint, and that can cause the joint to break down further, where there's a lack of nutrients to the cartilage, the bone, the joint itself. The joint doesn't have very good blood flow after you're a teenager, so really it does rely on movement to be healthy. So for the anatomy and the physiology of the joint, there's cartilage at the end of the bones, and this cartilage works like a shock absorber to protect the joint itself. There's fluid in the joint called synovial fluid to help you to be flexible, to move and bend and still give you lots of fluidity in the joint. There's a lot of space in that joint, so not only is there fluid, but there's quite a bit of space in between the bones. And then there's symmetry, so the joints have a balance between right and left in each joint, and the body's designed to, for each joint to absorb a little bit of stress or strain in the body. What are some common conditions that we see in the clinic? Well, arthritis is very common, and out of the arthritis category, osteoarthritis being the most common condition we see in the clinic. Next most common arthritis we see is rheumatoid arthritis. And then the third most common is psoriatic arthritis. So there's a difference between those. The osteo is more of a bone type of arthritis where there's a breakdown of the bone, usually from injury or imbalances. Rheumatoid is more of a systemic arthritis that sometimes can run in families, but it's many different joints in the body. And psoriatic arthritis accompanies psoriasis, a condition where the skin is affected, there could be scaling of the skin, and then the joints are affected as well. So what do we do in the clinic? Well, I'm a chiropractor, so we assess the posture and the alignment in the body. We do a thorough history. We want to find out the backstory behind what's causing the discomfort and pain for you in the joints. We'll do an examination to pinpoint what's causing the pain and discomfort. And then we take x-rays sometimes. So if they're necessary, we'll take x-rays. We have digital x-ray in the clinic to find out exactly what kind of condition the joint's in, if there's been any damage, anything else like pathology that we're looking for on the x-rays. And then we put a plan together. How are we going to correct what's causing your pain and discomfort? How are we going to restore the function in the joint? How are we going to rebalance the posture, and then give you the right supports and advice going forward? So what can you do to help yourself? Well, number one, you want to get more active. And I know that's hard sometimes when you're in a lot of pain. you first go see the chiropractor. It's very hard to get active because the pain and discomfort in the joint is just debilitating. So the first thing we want to do is just get the patient feeling better so that they're able to get more active. And then secondly, we want them to do things to protect the joint. So we want to make sure they're not injuring themselves or re-injuring the joint as we proceed. So that's the first step. We want to give the patient some low impact exercises. Swimming is really good, or just walking in the pool. And then we want to talk about posture and strengthening the joint, diet and lifestyle, and weight management. So they're all very important lifestyle considerations when we talk about long-term joint health. So what can we do in the clinic? Well, we can help our patients with braces, like in this picture, the knee brace, with orthotics, which help you with the alignment of the foot. If you're standing a lot, the foot and ankle alignment are very important for the rest of the joints in the body. Proper footwear, pillows or supports, especially when you're sleeping, a good mattress, recommendation for a chair or other products to help you with the inflammation and the joint. Sometimes this week I gave one of my patients a recommendation for lotion to go on the joint that's anti-inflammatory and helps with the pain. It has an analgesic quality to it. So what else can you do? Well, swimming and walking, biking, the elliptical, and yoga. These are all low impact exercises, very easy to do just to get the joint moving without putting a lot of stress on the joint. So we don't want you to be overwhelming the joint with a lot of stress or pressure. We definitely want to give the joint a break so it can heal. And doing some of these low impact exercises is very important. Once you start to get the joint more mobile with the chiropractic care that we're providing and some of the stretches and exercises you're doing, the next step is to get some strength in the joint or stability. So we want to protect the joints. We want to get the muscles and tendons stronger. We want to make sure the joint's well balanced, and we want to get the support around the joint to prevent it from getting injured again and be able to handle the stress of weight bearing or lifting or whatever you're doing on a daily basis. We also talk to our patients about eating healthier, and what I mean by that is anti-inflammatory foods. So foods that can help you, like omega-3 fatty acids, or fish or nuts, or monounsaturated fatty acids. So just different foods that are more anti-inflammatory versus foods that are pro-inflammatory. So a good diet's important both for the rejuvenation of the joint, but also for the inflammation that's present. And then we talk to our patients about good habits. So changing your lifestyle habits so that you can stop some of the bad habits, start to establish good habits. I just put that into the patient's consciousness so they can plan or start to make some commitments to better health in the future, and then start to schedule that in their calendar. So make it a priority, spend some time on a daily basis or every other day doing activities like going to the gym and working out, like going for walks, like going grocery shopping and having a list for that. So there's a number of things you can do to help yourself, and as a professional, we want to help you with some guidance. I did write a book on back pain, and that was published on Amazon. It was published in 2019. So it is there. If you're interested in learning more about joint pain or back pain, you can go to Amazon. It's in the Kindle Unlimited library, so you can borrow it if you're part of the Kindle Unlimited program. But you can also get an ebook and a paperback and an audiobook as well. And I did write a book on neck pain as well. And that book includes headaches and whiplash, concussions, basically different conditions that are associated with the head and neck region. And that's on Amazon as well in those 4 formats. that I just told you about. If you do have joint pain, you can give our office a call if you're located in the Kelowna area. Our phone number is 250-486-0062. We'd be happy to help you. We are accepting new patients right now. And we're located at 105-1628 Dixon. That's the Landmark 4 building in Kelowna. Our phone number is 250-486-0062. And my email address, if you have any questions, drcarryyurku@gmail.com. We are on social media, so please follow us on Instagram, Facebook, and Twitter. And the handle is @drcarryyurku. Often with these webinars, we will upload recorded copy on our podcast called SuperHealthy, and that podcast is on Apple, it's on Spotify, and it's on Google as well. So go to your favorite podcast provider and type in SuperHealthy, and you can subscribe to our channel, and you'll get the updates of all these different webinars we do on a weekly basis. And then on YouTube, it's Dr. Carey Yurku. You can see a video recording of this webinar on YouTube as well. For an offer, if you're interested in coming to our clinic and you want to book an appointment, just mention that you're on this webinar and we're offering you 15% off your first visit. I'll put a link in the post today in the event. So if you want to book, it's pretty easy. You just click on that link. It'll take you to the scheduling page, and then you can go ahead and book a time that's convenient for you. We are in 6 days a week, so including the weekends. So if you do need help, we're here to help you. And most new patients can get in within 48 hours to see us. And when you do click on that link in our post, you'll see something like this. And then you can just choose a day that suits you. You'll see the time pop up on the right side. And then you just have to enter your information, and we'll send you a confirmation with the new patient paperwork. And it's pretty easy. You'll just fill that in. You can e-sign it. And then when you come in for your appointment, we'll be ready for you. And we can start that process of doing the history, the exam, and give you the proper diagnosis so that we can do the right treatment for you, give you the best advice, and then help you along the journey. So I want to thank you for joining us today. It was a pleasure being here on Facebook Live and on Instagram Live as well. And please join us for the future webinars we have coming up. We do them on Wednesdays and Saturdays. So you just have to go to our Facebook page @drcarryyurku and then click on events, and then you'll see the events listed, and then just click on the event you're interested in. A lot of them are spinal related or joint related. Some of them are more specific. So please join us on those webinars, and we look forward to seeing you there.